Welcome to the NewlyMeds podcast. Any views or opinions expressed in this podcast are our own and do not reflect the views of our employers or affiliated organizations. This content is for informational purposes only. Always follow your local policies, protocols, and medical direction.
Hey, what is up, guys? And welcome back to another edition of the NewlyMeds podcast. Today, Dan and I are doing something a little bit different to close out really the year. And if you tuned into our last episode, we did a bit of a year in review. And today for our quick crit, we're going to be talking about burnout. And Dan and I are kind of just going to have a tabletop discussion with each other, something that we haven't had the opportunity to do yet on the podcast, in the true sense of this is just Dan and I talking to each other about how we've been affected by burnout, some of the things that we do ourselves to negate the burnout. And maybe you can take away a little bit from our conversation how you could manage your burnout in the field. But without further ado, I kind of want to jump into this quick crit today, Dan. So how have you been doing? I got the Christmas sweater on. We're coming up on the holiday season, trying to get in a little bit of the festive time of year. How's everything going with you?
It's going great. Yeah, I'm waiting for, I got a little tree for the office here to throw up for the background, but that's not going to matter since we're recording now. But no, I've been doing really good. As you may or may not know, I did start a new job recently, and that's kind of part of the reason, one of the reasons why we wanted to have this kind of talk about burnout is that I was coming from a pretty significant point in my career where I was feeling very both burnt out and kind of stuck at the company that I was at. And with this switch to this new career, to this new place of employment, to this new geographical location, I feel happy again in my career, in my profession, and I don't feel like I'm stuck at work and put in positions that I don't want to be in professionally, as far as subpar patient care with subpar equipment and those types of things. And Will, I know when we were kind of just hashing out this idea of having this conversation, I know that was one of the things that we were talking about is where do these roots of burnout come from? Is it the call types? Is it, the place of employment? Is it co-workers? Is it an amalgamation of all of these things? And ultimately it is, or can be one, or can be all, right? So I think I know that's where I was coming from in my point, but I know, Will, you and I last week when we were talking about this, you were kind of coming at it from a different angle as well. So how have you been doing, and how's things been going with you?
Yeah, it's good. You and I have had many conversations at this point. I sort of rotated careers, and starting out, everybody on the podcast knows you sort of have been with me on my entire academic journey thus far outside of my undergraduate career. But you were with me as a brand new paramedic and with me all the way through nursing school. And now I'm an ICU nurse. And it's a little bit different. I've always loved EMS. It's been my passion my entire adult life. Ever since I got into it, I knew it was exactly the job that I was meant to be in. It was weird because I always tell people I got so lucky. I never felt like I was working, and I fell into a career that never really did feel like a job. Ultimately, there were some nights that I worked that it did feel like a job and that I was doing work, but more often than not, it didn't. And I think, Dan, what you said was pretty true. We were on the same rotation for a long time, and coworkers really made the difference. And so I sort of saw the revolving door of coworkers leaving, new ones coming. And I think that started to burn me out a little bit. I was also in nursing school at the time while being a paramedic, and I think that added a little bit of extra stress, but not really, because EMS was sort of my outlet. That was what kept me from having a lot of nursing school burnout. But now I'm in this weird little limbo area of my career to where I don't necessarily love my new job, and I'm not afraid to say that. I know myself as a person. It's not really what I imagined myself doing on a day-to-day basis. And so now I'm sort of in this limbo section that you and I talk about, is how do I get back to loving my job? Because I do sort of feel like I'm going to work, And I never felt like that when I was in EMS. And so now how do I find something to where I love what I'm doing and I'm making a career out of that, but also using my degrees and using my certifications to the best of my ability while providing a high level of patient care. And then with that, how do I outside of work really help myself in my life to not let work carry over? So if I'm miserable every single day in work, how am I not miserable at home? And I think that's it's a really thin rope and tight line to walk, 'cause, it does spill over, Dan, and I'm sure you know that.
Oh,
So
absolutely.
that's
Absolutely.
yeah, that's a little bit of the catch up on where I am. But I kind of want to have a discussion with you about how you deal with it and how I deal with it. So, kind of like I was saying, we saw a lot of people come and go, and ultimately you left to go to a new service. So, tell me a little bit about when did you know, kind of like we both knew we were sort of each other getting burnout, and I think working on the same shift, working with each other, I would oftentimes remember push you to being like, "Hey, like you can do something else. You can do so much more." And I know that you even went out of the higher volume area to a different location off of a MICU. You were by yourself, but ultimately you're somewhere entirely different now. So things didn't go exactly as planned, but I'm so glad to see where you are because you seem to love it. So tell me, when did you sort of how did you figure it out for yourself?
Well, and I think you bring up some really great points there, and I think it comes with a sense of self-actualization, and I'm not saying that in like I'm very good at that because I'm really not. But I think it got to a point for me personally, it got to a point and I've and maybe you can speak to whether you've seen this as well, but it feels very cyclical at times where you kind of go through this period of burnout, and then you are able to kind of reshift that mindset and get back to a better place, and then you do good for a while and then you get back to another cycle of burnout. And I feel like when I knew it was time to finally start making moves was when that cycle of burnout, that cycle of essentially depression,
Mm.
was not breaking. It was not getting better. And no matter what I was doing at work, whether I was trying to cut back at work, whether I was trying to engross myself more in work on the education side, nothing was really helping that. So as you mentioned, I left the urban station that we had and went to a more suburban, lower call volume, um, chase car setup versus multiple MICUs or ambulances, and just try and get a change of scenery, a change of pace. And while that helped some, that really still didn't help. And so I knew that it was time, like you had said, we've seen the revolving door, especially in that in a larger corporate EMS type of setting. You see that revolving door of people coming and going, and you always wonder, is when should be my time? Am I a lifer? Am I, using this as a stepping stone? And I think, it got finally to the point where I was starting to not enjoy things outside of work. I was literally getting off of shift, going home, sleeping, eating, going to work, and that's all I was doing. My days off, I did very little outside activities. Um, and it was also an interesting time. There was a lot of going on in my personal life, both on the personal side as well as, relatively recently finishing paramedic school. Prior to finishing paramedic school, I've been in you know, some type of educational program, the large majority of my adult life. So I didn't have that to kind of fall back on to work on. And so it was just kind of a lot of idle time, which I was not used to. And so I think kind of all of those pieces put together there, eventually I was able to say, hey, like I need to make a bigger change. Yeah, and that's what I came to, that everybody's situation is obviously going to be different. I'm not saying if you're feeling burnt out, move halfway across the country. That's not the point that I'm trying to make. But I think you have to really start looking at where you are in your personal and professional lives and seeing if there is something out there that's going to better align with what you're looking for ultimately.
Yeah, Dan, you made such a really valid point in what you just said, and you kind of did it differently, but I wanted to emphasize something that you said. And when you start to feel burnout, by no means are we saying, you know, move across the country. And Dan, you made a career move that I think was phenomenal. And I know you and I talk pretty much every day, and I know how much you're enjoying it. And so for you, that was the solution, and it seems to be going great. But sort of what I want to emphasize is a few things. As someone who's been in healthcare for a while and has seen, a few of the changes, even just being in healthcare since COVID, because you were in it as well as I, and now seeing this post COVID, and you've even been in healthcare a little bit longer. My mom has been in healthcare a very long time. She's been a nurse for over 35 years. And so I get to have some really unique conversations. And we sort of see how healthcare has really turned into this businessy type of thing. But at least in EMS, I feel like we've always fallen back on just providing good patient care because we have the ability to do so. And you and I have talked about it on the podcast before. If you don't want to be a medic that is high speed, pushing out, all the things that are within your protocol and really treating patients, and you're sort of just checking the boxes that you need to check, like just taking one 12 lead and calling it a day rather than serial 12 leads. Maybe that's a little bit of the burnout talking. But the point I'm getting to is, when did you know that it wasn't just where you were? You switched stations and you were still burnt out, still had that depression, and you made the career move to move halfway across the country. And ultimately, as a paramedic, as a nurse, as anybody in healthcare, the sad truth is that you are a license to them. You're a patch. And as much as we want to feel valuable, that we're giving so much to the company, they might not always see it that way. And at the end of the day, it is a lot of these dollar signs. And we're expendable. And I'm sort of seeing that, even as a nurse. Like, if I'm not liking my job, every other nurse that I have talked to about it, that I said, I'm not really loving this, they're like, just leave. Because I can go anywhere as a nurse, and there's really no one incentivizing me to stay. The hospitals probably, see me as just another nurse. I'm nothing special. I'm on the payroll, and I'm just doing a job for them. And it's the same thing in EMS. I was just a paramedic. Like, I tried my best to be on committees and do more. And I was on an education committee. I was a field training officer, sort of progressing my way up the key provider stuff and all that. But at the end of the day, I was just a medic to them. And I think even as you go higher up, into the admin, you're still just as expendable. So at what point, Dan, did you realize, like, it's not just the location, it's not the setup, whether you're on a chase unit or a MICU? When were you like, this is not for me, like my location, my life? How did you figure that out?
Well, I think exactly what you were saying there is that when you when I was trying to make the determination if this is something that I wanted to do, being a major move, obviously there's unknowns that go into that. I could be moving somewhere to another department that is, the type of same type of setup as the previous department that I was at. But I think what ultimately got me looking at that type of more of a drastic move was the availability in my personal life made that easier, certainly, but the continued feelings of, and not even feelings, but demonstration of exactly what you were talking about, that expendability, that just being another number, just being another patch, just being another paramedic, just being another person that's filling an open job vacancy versus where, and depending on where you're at, you may or may not believe this, but because I know a lot of people in the geographical area that we came from, we don't often believe that there are better things out there, but there really is better things out there. Even if you're not a nurse, even if you are an EMT, a paramedic, there really are very good options out there. where you can actually go be respected in your job. But I think that's what it ultimately came down to, was just the feeling of lack of respect. Like you, Will, I sat on numerous committees. I was an FTO. I was one of the lead adjunct instructors and taught countless hours on top of my normal regular schedule, and tried to do as much as I could for I mean, there's a selfish side of that too. I enjoyed that for a very long time, but that even got to be to the point where that was not bringing me the same initial joy and fulfillment that it was initially. And I think those kind of all of those symptoms together, that just continued feeling of lack of respect, that continued non-fulfillment in my various job roles that I previously had fulfillment in. I think that's what kind of really pushed me to start looking elsewhere. I don't know that there was one specific. There were a handful of a variety of events maybe that transpired that kind of were the tipping points, but there's no one specific thing. It was just these continued feelings that steered me to look somewhere else.
Yeah, Dan, I think it's really great that you mention that and talk about it. The one thing that I sort of want to close by, because I feel like you and I could have this discussion for hours, days, weeks. Like some of the stuff that I do to combat the burnout that I have at work is my personal life outside. I like to lift, play golf, hang out with my friends. I watch a lot of football in the fall, and that seems to all be good and great and help me with my burnout. But at the end of the day, you know, you have to be happy in your job. We're going to spend most of your life working. That's just the reality of it. Um, and in healthcare, people really rely on you to be at your best. They rely on you to take care of them, and especially in EMS, they're relying on you for their life. People are calling 911 when they're having the worst day, and we're the ones who have to show up and take care of them. And the one thing that I sort of want to close by, and that I want to urge our listeners to, if there's anything that they get a take away from this episode, it's that when you are feeling burnt out, when you're searching for a job in EMS or in nursing or whatever you decide to do, ask about the culture. And I don't mean just going into an interview and saying like, "Hey, what's the culture like here?" Or can I talk to a couple of street providers and like hear about the culture? I mean, find someone who seems like they are in the back corner doing their chart, minding their business, saying, "Hey man, like what's the culture like here? How do you feel here? Do you feel like this is a career move for you, or do you feel like this might not be the best place for me?" Because at the end of the day, culture is everything. And when you want to feel like you're valued at work, you can try to be the change and you can try to bring such a positive attitude and always smiling, always going the extra mile, taking the trash out, cleaning the office, cleaning the EMS room, improving it, painting the walls, whatever. At the end of the day, if that top down culture doesn't value you, and it just bleeds in more and more, and the more you put into a company that doesn't really value who you are as a provider and a clinician, you're never going to get that fulfillment. But when you go somewhere that has a culture that is like, "Hey, we love that you're here. We love what you're doing. You're doing an excellent job." You get recognized on going that extra mile. And that is your everyday life. I mean, everything is so much more enjoyable. That's really when I don't feel like I'm at work. When I'm going in and the people are there making it great, the culture's there making it great. My chiefs, my bosses, my whoever in management, they're like, man, it's not just a kudos. It's not just a pat on the back like you're doing a great job. It's something where I do something that nobody else saw, yet somebody sees it and recognizes me for it. And again, not just a pat on the back, not just a couple of points on maybe like a nice job, company wide point distribution app where you can buy a water bottle or something.
Right.
It's somebody who really values you as a provider. And they're like, "Hey, I'm not just telling you this because you did a good job, but like, we love that you're here. We want you to be here. And we want to put you in a position to succeed." And so for you, Dan, you kind of had to travel a long ways for that. But I know that those are probably questions that you asked that brought you to where you are now.
Well,
But
and
at least
Will,
for
not to
me,
cut you
go
off,
ahead.
but I don't
Yeah.
know. We may or may not have even had this conversation. But one of the comforting slash deciding factors prior to even making this move, prior to accepting the job. Um, the chief had reached out to me. He said, "Why don't when you're in the area, why don't you come by the station?" He's like, oh, I take that back. This was right after I accepted the job. He's like, "Why don't you come by the station?" He's like, "I'll take you by the different areas. We'll meet some of the people, and you can just kind of get a feel for what's going on." And when I walked into that station for the first time, it wasn't the, "Oh crap, the chief's here. Everybody look like you're doing stuff and try and pretend to be happy." Like, people were smiling, people were talking, people were, one person was working on chore related stuff, and I think two others, they were working on annual competencies, getting ready to studying for that for the year. And the chief wasn't there. They were doing that on their own. And it's like, was refreshing to walk in and see people not only working and studying and taking their jobs and their profession seriously, but also willingly and happily, without the chief sitting over their shoulder and saying, "Oh, you have to do this." And I think that it leads into exactly what you were saying, is that of that culture where when you have management, from even the lowest levels of management up, when you have management that supports that, that creates an environment and a culture, like you said, that just allows for its employees to get that fulfillment that they need in their career.
Yeah. And
And
Dan, by no means what you're saying, like something that I want to leave on, and I know I sort of was closing on the last, and then I'll let you get your last bit in because I know you're itching at something here. But I'm not saying, and I know Dan's not either. We don't want to get at the fact that it's like you need to move far away to find this. Someone who avidly listens to this podcast, and I expect you to shoot me a text after you hear this portion of it, left a company that they did not feel valued at and didn't feel like they were a provider at, and were fairly high up at that agency, and went somewhere else and is now pushing for things and getting things approved that nobody else in really the area or even the state is getting. And so it's not to say that that person had to travel super far away to find somewhere that they felt value, but for someone else, maybe you do. But what I want to say is cast the wide net. Don't just pull the trigger on something because you got a job offer. Go somewhere where they value you. At the end of the day, you worked so incredibly hard for that license, the time and effort and dedication that you put into it. At the end of the day, don't go somewhere where someone just sees your license. Go somewhere where they see you. And Dan, I know that you probably know that more than anybody with where you are now. And I'm going to let you close out with whatever you want. But as far as what I have to say with the burnout, please, you don't have to go a million miles away to do it. Maybe it's right across the lake or the river or right across the street. But find that place that makes you feel valued, that values you as a person and doesn't just value your license. And I promise work is never going to feel like work. Some days will, but the vast majority of your life, it won't. And you're just going to have so much more pleasure and joy in your job. And that carries directly over into the patient care. And at the end of the day, if you're going to work in healthcare, if you're going to be somebody that provides direct patient care, you have to be tip top because those people rely on you. And the same thing in a hospital setting or pre-hospital, anybody with direct patient care. Those patients relied on you to be at the top of your game. And I can assure you, when you're miserable and hate your job, even if you say you are never, ever at the top of your game taking care of that patient. Dan, I know you're itching, so
Well,
chip away.
I just wanted to bring this back. Number one, I agree 100% that no, you absolutely do not have to take the route that I took and move across the country. It could be right across the street. There was a whole bunch of different reasons why I was looking nationwide. I just wanted an adventure, essentially.
Mhm.
So you absolutely can find that across the street, across the river. Um, I fear a little bit that we kind of, and this is mostly my doing, because I talked about this right before we started recording, was that this ended up more so being a conversation about job specific burnout. It doesn't have to be just related to the job, to the place of employment. It can be, like we said, it could be any one of those factors, whether it be the call volume, whether it be stress at home that's bleeding into these other factors at work. It could be, you know, any mix of these various factors. So just, you can have that supportive environment and still have burnout. So
Yeah.
that's not to say that those cases don't exist, because they absolutely do. But Will hit it on the head earlier when he said we have to find something that is our outlet,
Mhm.
regardless of what it is. You have to find something. While yes, we do need to be masters of our craft, and we do need to be studying, and we do need to be taking the time to make sure that we are learning the new evidence-based medicine, and continuously studying for the benefit of our patients. Make sure you just set a set amount of time, maybe half an hour a day, or a couple hours a week, or whatever works with your schedule, with your life. And then set that time aside, do the work, and then put it away.
Yeah.
Find that outlet, participate in that outlet. And I think where this conversation originated was that when these outlets are no longer working, when you're still feeling the burnout and the outlets aren't helping, well, maybe that's where you're looking to see if there is something else that can change. And it might not even be a job change. It might be a position within the company, or it might be a different station, or it might be a different shift, or it might be, something to that effect.
Yeah.
But when you're still feeling the burnout and your outlets that previously were working are no longer working, that's when it might be time to start looking for a change.
Absolutely. And making sure that you have that outlet, something to do that's not the job. Like I said earlier, I recently have found myself, I've golfed pretty much my entire life, but I've really gotten into it, um, especially on my days off of work. And it's something that's 4 hours that I can get away from everything. I'm just focusing on golf. And if anyone on the podcast is also an avid golfer, I'm about a 4 or 5 handicap right now, working to get the scratch. I'd love, if you're feeling burnt out, let's get a round in or something, please, because that's my outlet. But it can be anything. Maybe it's fishing, maybe it's watching movies, maybe it's yard work, anything.
Right.
Making sure you have something that's not the job, that just get away. You know what I mean, Dan?
Yep. And then one last thing here is, I think, the most important thing that we probably should have led off with, but the most important thing is a support network.
Absolutely.
Having, doesn't have to be quantity, quality over quantity,
Hmm.
1, 2, 3 people, whatever it is, that you can talk to, that you can express these concerns with, that they can work through these types of things with you. And I think it's important to note too, while it's important to have at least 1 or 2 of these people that are in EMS, because that does help, or in healthcare in general, in a similar type of field that you are in. Because let's face it, we see things, we deal with things that a lot of people don't understand. And so having that other person that does understand certainly does help
Hmm.
strengthen that bond and that support network. But have people outside of EMS, outside of healthcare, that you can rely on in that support network too. Because how many times do we go out as a shift, or as a group of paramedics and EMTs, nurses, we all get together and, oh, we're not going to talk about work, and literally three
Well, we
minutes
talk
three
about
minutes into breakfast, and we're talking about work.
yeah.
Have some people outside of that that can be a part of that support network as well, to, again, to kind of to keep EMS, to keep healthcare out of that, and to stay focused and centered on things that can be used as outlets.
Absolutely.
But yeah, I think, Will, if you don't have anything else.
Yeah, Dan, I think we covered a ton of it. I have nothing else to say, and I'm really glad we got to sit down, especially as the year wraps up, and talk about this. And burnout can be especially hard in the winter when some activities get more limited. So if you need anything, please reach out, shoot us an email. We are always here to talk, not just to each other on the podcast, but we want to engage with the listeners. And if you're feeling burnt out, let us know. Maybe we can point you in a direction that helps.
Yeah, absolutely. But
All right.
with that being said, this it's December 15th now, so we're coming up on all of the holidays. So enjoy that time. If you celebrate, whatever you celebrate, if you don't celebrate, it's still a good time to just have some good self-reflection, spend time with family and friends, and just enjoy the beautiful weather. Hopefully, where you're at, maybe it's a white Christmas coming up. But we look forward to hearing from you guys on TikTok, YouTube. Shoot us an email, not only with burnt out related stuff, but what do you guys want to hear about next year as we start planning out? I know we have a couple really exciting things hopefully on the horizon, but any other topics that you guys want to hear about? Like we've said before, we'll certainly ramble about anything, but we want to talk about things that you guys want to hear about. So any suggestions there, let us know. But otherwise, I think that's it.
All right. We'll definitely catch you in the new year, guys.
All right. See you next year.